Thank you, Ranking Member, and thank you, Chairman. I sat here in this committee hearing and my head is just spinning. Been on this committee for 3 years, and I'm not sure we've made any meaningful impact yet on diabetes, a huge epidemic, as we already know this. Certainly there's opportunities to attack the nutrition standpoint, the education standpoint. It's time to stop studying it and forming committees. It's time to move forward with action. I think we all understand the cost of prescription drugs is part of the challenge here. It's interesting to me that in 2022, Americans spent $633 billion on prescriptions. $633 billion. Almost $500 billion of that went through the hands of our pharmacy benefit managers. So 5 out of $6 that Americans spend on prescription drugs go through the hands of pharmacy benefit managers. And of course, there's kickbacks. They give some of that money back to Medicare and insurance providers, and we have no idea who and how much those are going to. But in case you're feeling sorry for the PBMs, they had a profits of $27 billion in 2022. $27 billion was their profit margin. Three PBMs are now ranked 4, 5, and 12 on the Fortune 500 list. So as I look to solving this problem of prescription drugs to treat diabetes, I try to figure out where's the biggest bang for the buck without destroying innovation. And I keep coming back to these pharmacy benefit managers. We've done incredible work so far to address this problem, but our work's not finished. We've sponsored the Drug Act, which is a bipartisan, bicameral legislation that would delink administrative fees paid to PBMs from the price of prescription drugs. Rather than paying a percentage of the drug, that there would be a flat fee. Obviously, the PBMs are motivated to, the higher the drug cost, the more they're going to benefit when they get a percentage of that. We've had great co-leads here with Senators Kane and Braun, and we withdrew our amendment because it didn't have a CBO score at the time. But this remains my top priority. We have the CBO estimate. Guess what? This is going to save the federal deficit by $654 million if it's fitted into the PBM Reform Act. Senator Collins said this legislation is literally right on the money, and certainly Senator Collins has been my mentor in trying to figure out what to do with diabetes here in many ways. The underlying issue is that PBMs favor higher-priced brand insulin over insulin biosimilars. We had hoped the biosimilars coming to market would help drive this down, but it remains a challenge. This legislation eliminates the perverse incentives of PBMs to block access to affordable insulin biosimilars and generic drugs. Is there anybody on the panel that would disagree that by delinking this would help drive down the price? Does anyone disagree with that? Okay. I just hope that to have a commitment from our folks, from this committee, that we would continue to work on this, and that somehow we could add this delinking amendment and get it as part of the package to move forward to actually impact the challenges that we have here already. I guess I got a minute and a half left. So let's talk about education and nutrition. I'll defend Coke and Pepsi for a second. They're going a lot to other more healthy drinks. I see them out there. And more I see young people, probably better so than people my age group, making healthier choices. Does anybody have any comments on how we can promote that education in a better way?
Sure. I mean, I think education is really important, and we could do better in our schools by requiring nutrition education, which I believe is not currently required. But we also know that education isn't enough because there are all of these other forces around marketing and pricing and really the confusing food labeling that makes it complicated. So when you're looking at that product, that sugary drink, and it tells you that it's got 100% vitamin C, it can still be hard to understand just how much sugar it has. So there are other things that we could be doing besides education that would help people make healthier choices, because we know people want to do that. It's just currently hard to do that even when they have education.
Okay, thank you so much. I yield back.